being a plastic surgeon in New York City for more than 24 years, it occurs to me that I can never quite explain enough how a tummy tuck is done. As a matter of fact, a lot of my friends who are doctors don't really know what I do for a living, and they kind of think they know how a tummy tuck is done, but they don't. I've got a patient here that I did a few years ago who had 3 children and a little bit of a belly button hernia, and we did a tummy tuck for her, and I was able to flatten her out significantly and make her outie belly button and innie again. So if you look at the bottom of her tummy, there's this little pouch, right? There's this little paunch at the lower abdomen that's protruding, frankly, because she had 3 kids. So during the course of the tummy tuck, I removed all of the skin from above the belly button, just above the belly button, down to the groin, just above the pubis. That was all removed. I then went underneath the skin and tightened up her abdominal wall and fixed her belly button hernia, and then took the skin from above and pulled it all the way down to the pubis and closed it. This does create a long incision. The scar goes from one hip across to the other. And there is a scar around the belly button. See, the belly button doesn't move. It actually stays right where it was the whole time. And the skin from above comes down over it, and we make a new hole to bring the belly button out. So there's a scar around the belly button, which is why it's so important to get this part right. The way I like to do my belly buttons is to make a hood over the top of the button, and then the only scar you really see is that short one on the bottom of the belly button, because the upper portion is tucked in underneath the skin fold. And of course, the long incision from hip to hip, that should always be covered by your bathing suit. That's why when we're marking patients, we make sure when everything lands, when it's all done, the incision will be within an inch or so where the patient needs it to be. As I was saying, I do a lot of tummy tucks in my practice, and if anybody is interested or has questions, please feel free to contact my office, and we'll see what we can do for you.